The reasons people come into the vets after preventative care, so vaccinations and parasite control, neutering, that kind of thing, is preventative type care. The other reasons would be through injuries or illnesses. So the common injuries we get do differ depending on what breed of dog is coming in or what species. So if it's a cat, dog, rabbit, reptile, whatever it is. So the same things will come in for each of those breeds or species. So with cats, probably the most common thing we see are cat bite abscesses, whether that's on a tail as the cat's been trying to run away, or on a head if they've been confrontational in their fight. Some of them, people will come in because they're just worried about a lump on the cat or a swelling, and it will turn out to be an abscess. Other times the abscess will have already burst and they're just worried that they've got this open wound then on their cat. Some cats will be perfectly fine with those abscesses. Some of them will have temperatures, have been off their food, maybe quite uncomfortable because the swelling is very uncomfortable. Actually, when the abscess bursts, a lot of cats then return to normal because they feel much better once the pain's gone. With dogs, we don't get that kind of thing. They do get into fights, but not the same as cats do. So the injuries we get, the wounds, the tears, the cuts, are mostly from doing something by themselves. So out on a walk, on stones, they've been swimming in a river maybe, and they've cut their foot on a piece of glass. That kind of thing is quite common. Foreign bodies are also quite common, so stick injuries, whether that's in a foot or in a mouth if they've been carrying the stick or catching the stick. Grass seeds, again, over the summer, that's a big problem. The other injuries we may get could be from road traffic accidents. Again, in cats, they are quite common. So we can get fractures, broken pelvises, that kind of thing isn't unusual. Tail injuries, so in cats there's something called a tail pull injury, and that's where they've got they had their tail caught where they've been trying to continue to run, and you get a neurological problem then, and the tail becomes very flaccid. They can't lift it, they can't do anything with it. So that can be with a fracture or it can be by itself. Those injuries are fairly common. The other thing we get a lot of are ear problems, so ear infections, eye infections. Dental disease is a massive problem as well. We believe that at least 50% of animals that come in have got some degree of dental disease, whether it needs treatment or just management changes, but 50% of animals will have some dental disease. So it's very common. We often pick that up at routine appointments. It's not the reason that people will bring their pet in, but if we can pick it up before it causes a problem, then that's where we want to be finding that. Illnesses, fevers, temperatures can make you feel quite unwell, so they will often present as my animal's just been a bit off the last couple of days. We then find out they have a temperature, and in most cases that's because of some kind of infection. Sometimes you don't manage to find out where the infection is, but you can control the temperature and the infection will sort itself out with antibiotics, or if it's a viral infection like a cold, flu type infection, after a few days of supportive care they often get much better with that. Urinary problems we get quite a lot of, so if an animal is struggling to urinate, or if they have blood in their urine, a different smell to their urine, anything abnormal, then the various causes for that. Sometimes you can have urine stones that will cause blood. Urine crystals are quite common in cats. They can cause blood in the urine. Urine infections are probably the most common ones you have. The gastro problems, so vomiting, diarrhea, liver problems, pancreatitis, that's kind of a group by themselves, and they are really common as well. You tend to find if you see one vomiting dog, you're seeing many, many more that week. So it tends to come in little bouts because a lot of these viruses are contagious. So if dogs are mixing in parks and things, they will catch them. So we'll see a week or so of lots of vomiting dogs, and then the next week, hardly any at all. So yeah, vomiting and diarrhea is a common illness. And then our hormonal conditions we get a lot of as well. Tends to be in older animals, but there are a lot of endocrine or hormonal problems that animals get, where people will first see symptoms such as weight loss, maybe an increase in appetite, increased thirst, increased urination, lots of those little signs that kind of creep up, and you wouldn't say your dog is particularly unwell, but just things that aren't normal for them. So we see a lot of those, and that they need a little bit of workup, a little bit of diagnostics doing to try and find out what's going on.